We're going to talk a little bit about bunions and bunion deformities and correction of bunions. This is a typical x-ray of a patient that comes in with a bunion deformity. As you can see, there are 5 metatarsal bones. The first one is the largest. This is the first, second, third, fourth, and fifth. The normal relationship between the metatarsal bones should be relatively parallel. As you can see, the second, third, fourth, and fifth are relatively parallel to one another. This particular patient has a pretty severe bunion deformity where the first metatarsal is deviated away from the second metatarsal. There's an inverse relationship between the first metatarsal bone, which we see here, and the toe bone. And my pen is going to represent the first metatarsal, and my pen cap, the toe bone. This is a normal relationship that we like to see. However, over the course of the years, sometimes a bunion develops, and you can see the first metatarsal deviates over, and the big toe deviates inversely in the opposite direction. And that creates a painful bunion deformity with shoes, a little bit unsightly. We sometimes see some redness, some swelling in this region. So how do we correct this problem? We make about a 6 to 7 centimeter incision in this region on the side of the foot. We remove this bump, bone saw. We also cut the first metatarsal head in this region, and we shift the head of the metatarsal this way, and once we shift the head out, the big toe generally starts to swing back into alignment. Occasionally, for severe cases, and especially in this case, we may have to take a wedge of bone out here as well. That's done by making 2 cuts, removing a wedge of bone. We use a wire to hold it in place. So once everything is done, we should have a rectus or straight position between the first metatarsal and the toe bone. This particular patient went and had the procedure done. As we can see here, this is about 6 or 7 weeks post-operatively. We see that the bump has been shaved off. The head of the first metatarsal is brought back over. There's a better relationship between the first metatarsal and the second metatarsal. We've removed that wedge of bone in the toe. We've used 1 wire to hold it in place, and we can see the toe is nice and rectus. For more information on this or other deformities, please consider contacting our office or reviewing more information on our website at www.greatfootcare.com. Thank you.